So a very good afternoon and welcome all. And today I'll discuss for your examination point of view. First medicine is Psorinum. So Psorinum is a very important medicine. Psorinum is a very confusing medicine too. And Psorinum has having very broad spectrum relationship also. There are lots of medicine get in brackets. So around more than 50 medicines you will get in comparison. Okay. So now start Psorinum. Next slide. So best way to study Materia Medica, always keep your book, especially Allen's keynote with you. This is the best way. Keep in mind. एक बार सुन लोगे अच्छा लगेगा, 2 दिन नहीं पढ़ोगे सब भूल जाएगा. अगर बुक है साथ में तो अंडरलाइन कर लोगे, एक बार देख लोगे कहाँ लिखा हुआ है. So here in this reference you will get 2 more medicines. One is Calcarea Phos and next one is China. Okay. Now open Calcarea Phos and just see relationship of Calcarea Phos. Calcarea Phos from Allen's keynote and just see relationship. Just see, I think similarity in second line. Debility remains after acute illness or some acute disease or after illness when weakness persists. So Calcarea Phos, Psorinum as well as China will also get in carboways. Okay, so keep in mind all these medicine. In my practice, just I will take around 20 seconds. In my practice, I use Psorinum in old age. If there is weakness after acute illness, in old age, I use Psorinum, and this weakness persists after acute disease. In adult, I use China, and in weakness persists in children, so I use Calcarea Phos. So this is my way of practice. I use my practice these medicines. So next. Very, very, very important for MCQ. The children are pale, delicate, sickly. Sick babies will not sleep day or night. Worry, fret, cry, jalapa. So this is very, very important that babies will not sleep day or night. In this reference, just compare 4, 5, 6 medicines. One medicine is bracket jalapa. ये भी एक तरीका है पढ़ने का, याद रखिएगा कि हर मेडिसिन में ब्रैकेट में कंप्लीट मेडिसिन नहीं है. सो कंप्लीट सेट ऑफ मेडिसिन वहां पे आपको बनाना होगा. ये तब बन पाएगा जब आपका वाइड स्टडी होगा या फिर कोई गाइड करे. इट्स ओके. आपने अगर पूरा आपने स्टार्ट किया एब्रोटेनम से जिंकम मेट तक ठीक से पढ़ लिया तो आप याद रहेगा, नहीं तो याद नहीं रहेगा. तो मैं यहाँ पे आपको कुछ एडिशन कराऊंगा, तो वहाँ पे आप पेंसिल से जैसे भी आपको कंफर्ट है उसको आप वहाँ पे मेंशन कर लो आप. सो इन ब्रैकेट देयर इज जलापा. Also keep in mind medicine is rheum. Very important medicine is rheum. Very important medicine is laccan. Next important medicine is nux vomica. Okay. Now open chapter laccan from Allen's keynote. Child, cross, irritable. Got the line? Okay, in bracket you get three medicines: Jalepa, Nux, and Psorinum. Right? Now, got it? Now open medicine Rheum. That is similar line, na? Cross irritable. Now open Rheum. Got it? So in this relationship, you got five medicines. Though in Psorinum there are only two medicines mentioned in bracket. So you got two more medicines. Okay. So you can remember all five medicine as a mnemonic that I make a that is Soja Lala Re. That is can remember easily. Soja stand for PSO means Psorinum. Ja stand for Jalapa. Lala stand for Leccan. And Re stand for Rheum. And this happens at night. जब मम्मी परेशान होगी ना तभी होगा ना कि सब लोरी सुनाएगी कुछ बोलेगी. So at night, night stand for Nux Omega. Is it clear? So all five medicines आपका क्लियर हो जाएगा. I think Psorinum, Jalapa, Leccan, Rheum, and Nux Omega. Okay. Again, next very important thing is Lycopodium. Now open Lycopodium from Allen's keynote. This is reverse of all these medicines. Cries all day, sleep all night. ये बच्चा बहुत बढ़िया है ना. मम्मी के लिए तो अच्छा है ना कि दिन में रो लिया रात में सो गया. Right? So all medicines are important for MCQ. Got it? So keep in mind all six medicines. Body has a filthy smell even after bathing. Okay. We all know that Psorinum is very offensive, very filthy medicine. Carrion like odor. ये सब पता होगा आपको. पर MCQ में जहां से पूछता है क्वेश्चन मैं उसमें फोकस करूंगा और MCQ में लाइन को कैसे डिफरेंशिएट करना है. कीप इन माइंड बहुत सारी ऐसी सिमिलर लाइनिंग है पर थोड़ा सा डिफरेंस है वो मैं आपको बताऊंगा कि कहां से उसको कैसे आप उसको डिफरेंशिएट कर पाओगे. So body has a filthy smell even after bathing. This is Psorinum. We also know that filthy smell, other medicine having, that is sulfur. And sulfur and Psorinum are complementary to each other. Yeah, as you all know. And another medicine having like similar smell, like sour smell. Yeah, sour smell. Sour smell. Don't be confused. Sour smell. You will get in Rheum. Within bracket, you will get Hipper and Maccar. Just open chapter Rheum from Allen's keynote. Got it? In Rheum, sour smell from body even after taking bath. Like that. Okay? Maccar and Hipper is equally important. Got it? And doctor, keep in mind, if in bracket you are getting two medicine, that line is very important. If in bracket you are getting 5-6 medicines, that is not so important for examination point of view. That is equally important for your practice, but for exam, you are talking about our examination. No? It clear? In Sanicula, there is odor of stool despite after taking bath. This is the difference. Keep in mind. Okay. So in Rheum, Maccar, Hepar you will get sour odor. In Sanicula, that odor of stool, that bad odor. In Psorinum, got filthy odor. In sulfur, also get this filthy smell. There are lots of other medicine having that offensive discharges. Like pyrogen is very offensive, but that is important for clinical point of view. In this reference, just keep in mind these 4-5 medicines. Whole body painful, easily sprained and injured. This is arranged in as per your actual source book of Allen's keynote. Okay, if you are reading some rearranged edition, you will not get all lines in order. Okay, so whole body painful, easily sprained and injured. Now open Carboanimelis. In Carboanimelis, you will get easily sprained, strained after even lifting slight weight. I think you will get in bracket. So right now, read. No, just also read second line. Carboanimelis. Easily sprained, easily injured. Okay. Clear? So here, Carboanimelis, Psorinum, that whole body painful. So this shows the sensitivity. So also open petroleum. That is very, very, very important for MCQ. Whole body skin is so sensitive, even clothings are painful. Got it? This is Psorinum. This is Psorinum. Now open chapter McCarb. McCarb from Allen's keynote. Whole body ache. Got it? Okay. So in this reference, petroleum, Carboanimelis, all are important medicine. McCarb, also similar line get in Medorinum too. Okay. Next one. Great sensitiveness to cold air or change of weather, wears a fur cap or overcoat. So patient is very chilly. Okay, got it? Now open Hypersulf. Hypersulf wants to be covered or wear fur even in hottest weather. So in this reference, got two medicine. One is Hyper and next one is Psorinum. Again, for MCQ point of view, if you have Cantripatry, chapter Mind, there is one rubric. A rubric is fur wrap. There is single medicine. There again, very important for MCQ. Single medicine is Hyoscyamus, not Psorinum, not Hypersulf. I think in chapter Mind, page number 30 might be. Rubric is fur. Wraps. Medicine is Hyoscyamus. Although we all know Hyoscyamus want to be exposed, don't want to be covered, want to be naked. But here in Cantripatry, you will get single medicine, fur wraps in summer, I think, and medicine is Hyoscyamus. Okay. Stormy weather, he feels acutely, feels restless for days before or during a thunderstorm. We all know. And that leading medicine is rhododendron. I think we all know. Rhododendron. Also keep in mind rush ducks. Also keep in mind phosphorus is also very fearful to thunderstorm. Also keep in mind petroleum, agaricus, gelsemium, sepia. Okay, so in this reference, aggravation from thunderstorm start from agaricus, gelsemium, petroleum, phosphorus. So I already discussed. Yeah, and rust ducts, rhododendron, sepia. You can check it in, I think, chapter agaricus. You'll get entire group of medicines. So rather than writing, that checking in book is this is the best policy. I'm saying again and again. Okay. So next, dry scaly eruptions disappear in next. Just so dry scaly eruptions disappear in summer, return in winter. Return in winter means contain aggravate in winter. Okay, so eruption in winter, the Psorinum we all know, other medicines like alumina, like petroleum. Okay, so petroleum, alumina, Psorinum, aloes. Clear? So in this reference, also keep in mind some like eruptions, that these four medicines having eruptions worse in winter. You can also compare with medicines like natrum sulf, like sarsaparilla. Here complain, yeah, eruptions worse in wet weather, worse in wet weather, worse in rainy weather. Now open sarsaparilla. Got it? Sarsa, natrum sulf. And next, now open aloes. Very, very important. Aloes. One line is there. Each appear each year as winter approach. This is third line of aloes. We think the aloe is only for piles. Got it? So winter aggravation, you got four medicine. In damp or rainy weather aggravation, you got in Allen's keynote, there are two medicine. Is it clear? And in calibichrome. Now open calibichrome. Calibichrome from Allen's keynote. Complaint occurring in hot weather. Okay, so because for calibichrome, eruptions are also important. Okay, there are lots of medicine having aggravation in hot weather. We all know. Start from gelsemium, start aconite, natrum mure, natrum carb, lots of glonoine, lacases, lysine, lots of medicine. I will confine only that related and important topic. Okay. Now next is ailments. Ailments. Yeah, one more comparison that complaint here in skin eruption. Although Psorinum for clinical point of view works, all complaint works in winter. Okay. Now open Auromet and Mercurius, equally important for MCQ. Just see Auromet relationship or aggravation. Many complaints occur only in winter. Auromet relationship or aggravation. Many complaints occurs only in winter. Got it? Okay. Also Mercurius. Although we know Auromet and Mercurius as a great anti-syphilitic medicine, and syphilitic symptoms worse in which weather? Summer weather. So there should be aggravation in summer, but because these are polycrest medicine and having symptom of all miasms, that's why Mercurius also worse in winter. Got it? Okay. You also like EPCAC also get aggravation in winter, but that is not so important. Ailments now. Ailments from suppressed itch or other skin disease. Very, very important for MCQ. Ailment from suppressed itch or skin disease when sulfur fails to relieve. Complaints after suppression of itch or suppression of skin eruptions. That consequences of suppression of itch or eruptions get in lots of 8-10 very important medicine I'll discuss here. Now open agaricus. In agaricus, you will get epilepsy from suppressed eruption. In agaricus, you will get in bracket sulfur and Psorinum. Got it? Epilepsy from suppressed eruption. Clear? Very, very important. And I told you if there are only two medicine in bracket, it is very important. So always keep in mind. For agaricus, epilepsy from suppressed eruption. Okay. Now open chapter cicuta. Cicuta. In cicuta, you will get brain disease from suppressed eruption. Got it? Brain disease from suppressed eruption. Very important for MCQ. I think you have read all these medicines. Nothing new. The cicuta you have read already. Huh? But this is MCQ point of view. This is MCQ angle. Okay. Open zincamet. Zincamet. Chorea from suppressed eruption. Got it? So in zincamet, there is chorea from suppressed eruption. In cicuta, there is brain disease from suppressed eruption. In agaricus, sulfur, Psorinum, got epilepsy from suppressed eruption. Although all related to brain. But just think about that this difference in line. Okay. Now open cupramet. Bad effect of repercussed eruption. In cupramet. Cupramet. Bad effect of repercussed eruption. Got it? Got it? Now open Cupramet relationship part. Cupramet relationship part. Similar to Apis and Zinkum in convulsion from suppressed eruption. Got it? I think relationship part. Last or second last might be. Is it clear? So you got 5 similar lines like convulsion from suppressed eruption, that in relationship of Cupramet, and you got 2 medicine here, Apis and Zincumet. In Zinkum, you got chorea from suppressed eruption. In Cicuta, you got brain disease from suppressed eruption. And Agaricus, you got epilepsy. Okay. And in Psorinum, you also get diarrhea from suppressed eruption. The diarrhea from suppressed eruption. Also get in Psorinum. And other important medicine for MCQ. There are total 4 medicines in MCQ in whole Allen's keynote. That is Epismale, Petroleum, Graphitis, and Psorinum. Epismale. Now open Epismale first. Graphite is also having that diarrhea from suppressed eruption. Okay, so Epismale, Graphitis. Now open Petroleum. Petroleum. You see the line, diarrhea only in daytime. Got it? That is also very important. Diarrhea only in daytime. That is opposite of Psorinum. That is opposite of Pulsatilla, Chelidonia. Will come after few lines. Okay. So 4 medicines we got, that diarrhea from suppressed eruption or suppressed itch. Okay. Psorinum, Petroleum, Apis, and Graphitis. Is clear? Headache from suppressed eruption. Headache from suppressed eruption. That is also very, very, very important. One medicine is Psorinum and next medicine is Antimonium crud. Open chapter Antimonium crudum from Allen's keynote. Okay. asthma from suppressed eruption. Now open hip ourselves. Asthma from suppressed eruption. Hip ourselves. In bracket, you will get Psorinum. Okay. So you got, I think 10-15 medicines. There's some brain complaints, some convulsion, some diarrhea, some asthma, like that. So this is the way to comparison. And the next one, feel unusually well day before attack. Okay. All excretions, diarrhea, leukorrhea, menses, perspiration have a carrion-like odor. Also very important line of Psorinum. Now open Carboanimelis and just the last line of Carboanimelis, just before relationship part. All excretions, menstruation, leukorrhea, diarrhea, all are exhausting. Then bracket arsenic, and all are offensive. Psorinum. Got it? So that line is also very important from Carboanimelis. Okay. Next. Religious melancholy, very depressed, sad, suicidal thoughts. Very depressed, sad, suicidal thoughts. Don't be confused with oromit. Okay. Despair of salvation. In cantripatry, despair from itching. There is single medicine in bold, that is Psorinum. Chapter is mind. In mind chapter, cantripatry, rubric is despair, itching from, there is single medicine Psorinum in bold. It's very important for MCQ. Okay. Driven to despair with excessive itching. Okay. Headache preceded by flickering before eyes, by dimness or vision or blindness. Leg defloratum, calibichrome, iris, there are lots of medicine. It's okay. Headache, always hungry during, and better while eating. In bracket, we will get anacardium and caliphos. Also keep in mind lycopodium. And doctors, lycopodium and anacardium also very close to each other. This hunger aggravation or headache worse when patient is hungry. That keep in mind lycopodium, keep in mind Psorinum, anacardium, caliphos. Apart from this, all medicines having ended with this is a vague term, ended with or you can say, are better by eating, like chelidonium. Okay, like chelidonium, like anacardium. तो एक मोटा कंसेप्ट है, ऐसा नहीं कि आप बोलो कि फिर कल क्लेम करो कि सर इसमें तो नहीं है, फिर कैसे रिलीफ हो गया, ये इसमें है पर इसको रिलीफ क्यों नहीं हुआ. तो आपके ये इजी मेमोराइजिंग के लिए है कि मैक्सिमम मेडिसिन जहाँ पे से एंड हो रही है उसमें ईटिंग से रिलीफ है. चेलिडोनियम, एनाकार्डियम, लाइकोपोडियम, सोराइनम, आयोडम. क्लियर? पेट्रोलियम, the relief from eating. Okay. And headache from suppressed eruptions, we have discussed earlier, or suppressed menses, or better by nosebleed. Headache from suppressed menses too. So here you got consequences of skin eruption, you got headache, you got asthma, you got suppressed menses. Is it clear? And better by nosebleed. And then in bracket you will get Melilotus alba. If you open chapter Melilotus from Allen's keynote, there you will get 3 more medicines. One is Buforana, Ferrum Phos, and Magnesia sulf. Got it? That epistaxis affords relief, headache. There are 3 medicines in bracket: Buforana, Ferrum Phos, and Magnesia sulf. Okay. Melilotus alba, not millefolium. This is Melilotus alba. Got? So there are total 4 medicines. You'll get headache relieved by epistaxis, although this is tubercular symptom. Okay, so better by epistaxis, get in Psorinum, get in Melilotus alba, Bufo, Ferrum Phos, and Magnesia sulf. Total 5 medicines. Clear? Next. Intense photophobia with inflamed lids. Cannot open the eyes, lies with face buried in pillow. There is photophobia with inflammation of eye. This is just opposite of conium. Conium maculatum or conium maculatum. There is also photophobia or irritation from light without any inflammation. Here is with inflamed lids. Got it? Next, okay. Otorrhea thinicorus, horribly fetid discharge like decayed meat. Chronic after measles. Diarrhea or otorrhea after measles or scarlatina. Doctor, very, very, very important. From measles, that most common complication of measles is otorrhea. Okay. Next. Acne all-form simplex rosacea, worse during menses. Acne worse during menses. Also very, very important for MCQ. And you can compare with lots of 10-15 medicines. Start from sanguinaria. Eruption in forehead during scanty menses. Now open sanguinaria from Allen's keynote. Sanguinaria. Medicine is sanguinaria. Eruptions on forehead with scanty menses. I think in young female might be. Okay. And in bracket you will get belly spur, sanguinaria, canadensis. Well-known medicine for right-sided headache. Okay, so in bracket you will get belly spur, calcarea, eugenia, Psorinum. Got it? So here in sanguinaria you got eruption of forehead or acne with scanty menses. Is it clear? Now open sarsaparilla. In sarsaparilla, in bracket you will get 3 medicines. There are eruptions or acne during menses only. Okay, here you will get eugenia, Psorinum, and sanguinaria. Got it? So one is scanty menses, there's only menses. Now open chapter Dulcamara. Dulcamara is in this line very important. In Delcamara, that you will get a start from res before menses. You will get in bracket conium. Got it? With profuse menses, you will get belladonna and graphitis. Right? So you got that acne worse during menses, acne what with scanty menses, during menses, before menses, and with profuse menses. Got it? And the Delcamara is very important, very important. And from coffee, from fat, from sugar, the modality of acne from coffee, from fat, from sugar. Okay, so acne worse from sugar, also equally important. And you can also compare with medicine like mercurius. From open chapter mercurius from Allen's keynote and just read line ailments from. Okay, got mercurius ailments. Ailments from, I think first word is sugar. You're not getting, not mercsol, not mercurius solubilis. I'm saying about mercurius. Got it? Ailments from sugar, insect sting, vapor of copper. Got it? And you also know one very important medicine, argentum nitricum, having craving for sugar and diarrhea from it. Argentum nitricum, having aggravation from sugar as well as craving for sugar. Okay, hungry in middle of night. Again, this is also psoric symptom. This is psoric symptom, hungry at midnight. Okay, or hungry at unusual time. It's also equally important for MCQ. मैंने पहले बोल दिया था आपसे कि मैं जो भी यहाँ पे डिस्कस करूंगा अगर क्लिनिकल होगा तो बोल दूंगा, दिस इज क्लिनिकली इंपॉर्टेंट. बाकी जो भी मैं बकवास करूंगा सब आपके एमसीक्यू के लिए बहुत इंपॉर्टेंट होगा. Okay, so hungry in the middle of night, this is psoric symptom, or hunger at unusual time, this is also psoric symptom. Must have something to eat, senna and sulfur. Also add here lycopodium. Also add here selenium. In Allen's keynote, you will get 5 medicines having hungry at midnight or at night. Selenium, सल्फर एंड लाइकोपोडियम. डॉक्टर जहां जहां पे सल्फर का रेफरेंस आएगा तो आपको देखेंगे कि साइड में आपको लाइकोपोडियम भी मिल सकता है. ठीक है, तो इसको तो आप साथ लेके चलना. तो सिना, सल्फर, लाइकोपोडियम, सोराइनम एंड सेलेनियम, all 5 medicines having that hunger at midnight or at night. Irritations, testing of rotten eggs, arnica, entemtat and graphitis. Rotten egg, irritations like rotten egg. Also add here magmure. Magmure. It's clear? So arnica, entemtat, graphitis, soranum and magmure, you get irritations like rotten egg. Next, quinsy, tonsils greatly swollen, difficult. Now very important thing is intense pain to ears on swallowing, painless bradycardia. painless quinsy bradycarp. Okay, that is very, very, very important for MCQ. We have huge comparison at this painlessness. Get this medicine having painlessness, that stramonium and opium. Okay, painless hoarseness you will get in calcareacarp. That is very, very, very important. Open chapter calcareacarp from Allen's keynote. Read fast. Calcareacarp, painless hoarseness. Got it? Hoarseness, painless, calcareacarp, painless sore throat. Although this is very contradictory thing. Painless sore throat. That is baptisia. Painless hemorrhage you will get in millefolium. Or just write down, you can check it later. Okay, so painless hoarseness at calcareacarp, painless sore throat, this is very important for MCQ, baptisia, painless hemorrhage is millefolium, painless gonorrhea is natrum sulph, painless diphtheria is diphtherinum, and painless hematuria is terebinth. In general, painlessness in stramonium and opium. Okay. So all 7-8 symptoms are very, very important for MCQ. Next one. Diarrhea. Diarrhea, sudden imperative, like yellow sulfur, stool watery, dark brown, fetid, smells like carrion, like involuntary, worse at night from 1 to 4 a.m. Diarrhea at night and 1 to 4 a.m. Okay. So Psorinum is also very, very important medicine for morning diarrhea, like sulfur. Okay. Like tuberculinum, like rumex, like aloes, like antimcrude. So in this reference, the diarrhea worse 1 to 4 a.m. or diarrhea at night. Can compare very, very important medicines that diarrhea only or usually at night, like pulsatilla. Open chapter pulsatilla. Just see that sentence started with diarrhea. Got it? Okay. And also open chapter chelidonium. Got it? So at night you got 3 medicines. One is Psorinum, chelidonium, and pulsatilla. Is the opposite of petroleum, as earlier we have seen in petroleum. Diarrhea from suppressed disruption as well as diarrhea during day. Is it clear? After severe, 1 to 4 a.m. aggravation. So don't be confused with other medicines like ammonium carb and calicarb. That in calicarb you will get asthma, worse at 2 to 4 a.m. And in ammonium carb you will get cough worse at 3 to 4 a.m. Doctor, also very important for MCQ. हाँ, तो अमोनियम कार्ब में आप देखोगे तो अमोनियम कार्ब में that 3 to 4 a.m. aggravation है, and within bracket you will get calicarb. ये ऐसा लाइन है कि चलते मेरा एनआई सिलेक्शन हो गया था और मेरी फ्रेंड का नहीं हो पाया था. द क्वेश्चन वाज asthma aggravate 2 to 4 a.m. and in option there are 4 medicines. One is calicarb, next is ammonium carb. So I just marked calicarb and he marked ammonium carb. तो आप सोच सकते हैं कि क्या एक एक सिम्टम का क्या वैल्यू है ना. और यहाँ पे जो लिखा हुआ है एक एक ना, although for clinical point of view, even in ammonium carb you will get calicarb, but that is in bracket. But this is main text of ammonium carb, that cough worse in 3 to 4 a.m. aggravation and asthma worse 2 to 4 a.m. aggravation. It is only calicarb. This is line of calicarb. तो याद रखिएगा, ऐसा नहीं कि आप बोलो कि सर ब्रैकेट में था मैंने तो ठीक किया फिर कैसे मेरा गलत हो गया. आप देखना होगा मेन टेक्स्ट कहां से है, मेनली लाइन किस चैप्टर से है, दैट इज मेन लाइन. फिर अगर पूछता है कि एवब 2 मेडिसिन एवब 3 मेडिसिन, तो वो आपको देखना होगा कि ब्रैकेट में और क्या क्या है. क्लियर. लोग बहुत एक्सक्यूज करते हैं ना, जब एग्जाम में नहीं हो पाया कुछ हुआ तो बोले सर मैं तो करके आया था फिर ऐसा क्यों किया, मैं क्लेम कर दूंगा. वो सब क्लेम से कुछ होने जाने का नहीं है. सिलेक्ट हो गया तो हीरो बन गए. फिर so 1 to 4 m aggravation, we discussed ammonium carb, discussed cali carb. Also keep in mind China, colic to exhausting sweat. Open China from Allen's keynote. So porous sleep, like that. So worse after 3 a.m. This is China, and next worse after 4 a.m. It clear? So just keep in mind this time modality. Clear? And daily attacks of colic at 5 a.m. Open chapter Calibrome. Got it? This is 5 a.m. Like Eupitorium perf, like 9 a.m. aggravation. Okay, and you will also get time modality in podophyllum. Also keep in mind Natrum, that 10 to 11 a.m. aggravation. That is very important for fever and for headache too. Natrum, like sulfur, aggravation 11 a.m. Also 11 to 12 a.m. That's okay. And within bracket of sulfur, now open chapter sulfur from Allen's keynote. And then natrum carb get relief after eating. Time modality is same. That natrum carb will get relief after eating. In bracket of sulfur. Keep in mind sulfur, bracket of sulfur. There are lots of medicines in Allen's keynote, but I've discussed few medicines, important medicine. Open Zincamet. Get 11 to 12 aggravation. And in bracket you will get sulfur too. Got it? Next, very, very important for MCQ, aggravation at 4 p.m. We all know about lycopodium. But question is not so simple. We all know lycopodium. Also keep in mind other medicines like colocynth, helleborus, and macphos. Now open lycopodium relationship part, or I think aggravation. Just see last line. Aggravation 4 to 8 p.m. Got it? Within bracket. Within bracket. It clear? So this is also frequently asking question. That colocynth and mag phos having 4 to 9 p.m. aggravation and 4 to 8 p.m. that lycopodium and helleborus. Okay. And cough at 4 p.m. Yes, very good. Millefolium. Open chapter millefolium and just see cough. After suppressed hemorrhoids, cough at 4 p.m. and within bracket you will get lycopodium. Okay, like 3 p.m. aggravation, you will get in belladonna and apis male. 3 a.m. and 3 p.m. aggravation you will get in thuja. Lots of medicines. Okay, we'll discuss one by one gradually. This is first class. Okay. Constipation obstinate with backache from inactivity of rectum. Constipation with backache, so don't be confused with aesculus hip. Don't be confused with Ehlers. Okay, as you all know, backache with hemorrhoids, backache with constipation, aesculus hip. Next. Hair dry, lustreless, tangents easily glued together. Okay, like plica polonica, not so important. Next. Enuresis from vesical paresis. Very, very, very important, doctor. During full moon. Enuresis during full moon. Very important for MCQ. That this moon aggravation, although not so helpful for clinical practice, but very important for your MCQ. Okay, so enuresis during full moon. This is Psorinum. You are having lots of medicine in Allen's keynote that having aggravation during full moon, aggravation during new moon, and we have studied so many times. और अक्सर भूल जाता होगा बाद में फिर वही क्या न्यू मून क्या फुल मून. हाँ, तो थोड़ा सा दिमाग में रखिएगा. निमोनिक. As we know, calcarea carb, that constitution of calcarea carb, fair fatty flabby, and abdomen is like inverted saucer like. So like this means पेट फूला हुआ है, ऐसा ही है ना calcarea carb. So just keep in mind that calcarea carb also having full moon aggravation. ऐसे full से full याद रखना. उसका पेट भी पूरा फूला है, full है. Calcarea carb also having aggravation from full moon. Okay. साइलिसिया कैसा होता है? साइलिसिया सिकुड़ा हुआ या लीन थिन? So साइलिसिया having aggravation in new moon. New moon कैसा हुआ? Crescent moon. No? Crescent moon, half moon, gibbous, then full moon. ऐसे अलग अलग फेज है ना मून के. वैक्सिंग मून, वेनिंग मून, है ना. जब न्यू मून स्टार्ट होगा तो पहले दुबला पतला ही रहेगा, पहले ऐसे ही रहेगा ना स्टार्टिंग में. तो देन हाफ हो गया, देन फुल हो गया. दिस इज क्रेसेंट मून, दिस इज हाफ मून, दिस इज फुल मून, एंड दिस इज गिब्बस मून. ना तो ज्यादा मुझे इतना नॉलेज नहीं है, पर ये आपके जो काम की चीज है उसको ऐसे कोरिलेट कर सकते हो आप कि न्यू मून एग्रावेशन दैट इज साइलिसिया पतला मून रहेगा, साइलिसिया पतला होता है. फुल मून एग्रावेशन, कैलकेरिया कार फूला होता है. एल्यूमिना हैविंग बोथ एग्रावेशन फ्रॉम बोथ न्यू मून एज वेल एज फुल मून. एक बार चेक कर लो, वेरी वेरी इंपॉर्टेंट फॉर एमसीक्यू. एल्यूमिना. Got it? So alumina having aggravation from full moon as well as new moon. Silicea new moon, calcarea full moon. And here anuresis symptom during full moon. Okay. Also keep in mind the line of lipe and doctors. जितने भी आपको कोट मिलेंगे मून रिलेटेड, मैक्सिमम कोट आर बाय लिपे. ठीक है. तो अगर क्वेश्चन कहीं यहाँ से पिक होता है, पूछता है कि, तो मैक्सिमम कोट लिपे ले दिया है. ओके. नाउ ओपन चैप्टर आयोडा. आयोडा. Most obstinate cases of goiter. Acts best in goiter when given after full moon or when moon is waning. Got it? This is iota. Important for MCQ. Now open sulfur. Just see line of menorrhagia. Not been well since last miscarriage. Single dose in full moon. Got it? Lippy. New moon. Yeah. Okay. This is line of sulfur. So complaints after last miscarriage. Sulfur, you got iodine, also compare calcarea, alumina, and silicea. And now open chapter calibrome. Calibrome and cupramate. Calibrome, you get symptom of epilepsy at new moon. Okay. Epilepsy, tubercular, congenital, and worse at new moon. Okay. Now open cupramate. Got it? So in cupramate and calibrome, got this symptom of epilepsy related to moon. Doctor, very, very important for MCQ. In cantriparty, there are no moon phases. There are no moon phases in cantriparty. That moon phases will get in BBCR and BTPB, but not in Kent. And next, very important thing, in cantriparty, you'll get moonlight aggravation. There is only one medicine in italic. There are total 3 medicines, but italic there is only one medicine, that is antimcrude. That patient is very sentimental in moonlight. I think आपने पढ़ा होगा है ना? So antimcrude. Moonlight aggravation. Rubric is moonlight aggravation in chapter generalities. Kent repertory. Leukorrhea. Next is leukorrhea, large clotted lumps of an intolerable odor, violent pains in sacrum, debility during climaxes. Okay, so large clotted lumps. Leukorrhea I'll discuss in Boericke, Materia Medica. The line is very important. Next. During pregnancy, most obstinate vomiting, fetus moves too violently. That is very important for practice. Moves too violently. If there is history during pregnancy, having this history, that when the best selected remedy fails to relieve, to correct the psoric diathesis of the unborn. It's related to aphorism 284, 6th edition, Organ of Medicine. Next one. Profuse perspiration after acute disease with relief of all suffering. Doctor, very, very important. Again, this is psoric symptom in general, better from normal discharges. This is normal discharge. That sweating is normal discharge. Okay. Leukorrhea, this is abnormal discharge. Clear? Coryza is abnormal discharge. Menses is normal discharge. Got it? So better from normal discharge. This is psoric symptom. Very important for MCQ. And aggravation from normal discharge. That is syphilitic symptom. देखिए ऐसे ही बेसिक चीजें हैं, आसान चीजें दिमाग में रखना रहेगा. ये सब कैरी करके फिर हम लोग थोड़ा टफ की साइड जाएंगे, पर ये मत छोड़ देना. लोग ना थोड़ा सा स्मार्ट बनने के चक्कर में थोड़ा सा टफ अनकॉमन चीज पढ़ते हैं, वही पूछते भी अपने फ्रेंड से, तुमने पढ़ा है क्या? नहीं. तो थोड़ा सा फ्रस्ट्रेट हो जाएगा, अरे मैंने पढ़ा नहीं, इसने पढ़ लिया. वो उतना काम का नहीं एक्चुअली, बस वो केवल फैशन के लिए है ना. बहुत सारी चीज हम लोग फैशन के लिए करते हैं ना. Not so important. And so like caladium, like natramure. This is pure psoric symptom. Very, very important line for MCQ. Caladium, natramure, and Psorinum. Better from perspiration. This is opposite of mercurius, opposite of heparsulf, opposite of nitric acid, opposite of opium, opposite of veratrum album. And doctor, just see mercurius, nitric acid. That both are deep anti-syphilitic medicine. Okay? तो स्वेटिंग से रिलीफ हो गया, तो ये ग्रुप हो गया. स्वेटिंग से एग्रावेट हो गया, जो मैं बता रहा हूँ, जो पूछता है एग्जाम में. मर्क्यूरियस से, नाइट्रिक एसिड से, ओपियम से, वेरेट्रम से, हेपर से. हेपर इज आल्सो ग्रेट एंटीसिफिलिटिक मेडिसिन. एस्थमा, डिस्निया वर्स इन ओपन एयर, सिटिंग अप, लॉरोसेरेसस. Listen carefully. Better lying down and keeping arms stretched far apart. So here asthma, better by lying down. This is Psorinum. Croup or croupy cough, better by lying down. This is Calibicrome. This lying down amelioration in cough or related to respiratory illness, get in 4 medicines. This is Psorinum. Line is asthma. Now open Calibicrome. Croup. Line will start from croup. Okay. Now open chapter Hyoscyamus. Calibicrome मिल गया. Hyoscyamus कफ का लास्ट लाइन देखिए, विद इन ब्रैकेट. एग्रावेशन लाइंग डाउन. ओके. एंड लास्ट में दिया होगा बेटर फ्रॉम लाइंग डाउन. दैट मेडिसिन इज मैंगेनम मेटालिकम और मैंगेनम एसिटिकम. Is it clear? Okay, so asthma better by lying down Psorinum, that croup better Kali by chrome, and also get in Manganum metallicum in bracket of Hyoscyamus. Now open Ferromate. Cough only during day. उसका लाइन देखिए, उसका लास्ट लाइन देखिए या सेकेंड लास्ट लाइन. Cough during daytime and better while lying down. Got it? Okay. This is opposite of lots of medicine. Start from Arelia racemosa, lachesis, Drosera, phosphor, lots of medicine. But for MCQ point of view, these four medicines keep in mind, and Psorinum and Calibacrum are very, very important. Cough returns every winter. As earlier we have discussed that winter aggravation. Okay, so cough, this single line symptom. Cough returns every winter. Next. Hay fever. Hay fever appearing regularly every year. Okay, hay fever, hay asthma appear everywhere. Every year, the same day of the month. Okay, so hay fever appearing every year. This is modality, this is symptom of Psorinum. Now open chapter arsenic album and just see last line of arsenic album. That is equally and very, very important for MCQ. Complaints occur annually. Complaints occur annually. And within bracket of arsenic, you'll get 4 more medicines. All medicines are very, very important and frequently asking question. Okay, the medicines are lachesis, arsenic album, carbovage, thuja, and sulfur. Am I right? So you can remember as a mnemonic lactus. So this lactus having complaints occur annually. Okay, so this lachesis, arsenic album, carbovage, thuja, and sulfur all are very, very important. Next. Okay, we have discussed cough, symptom of cough. Next. Next. Yes, complementary. Sulfur and tuberculinum. Sulfur and tuberculinum, complementary of Psorinum. Okay. After lactic acid in vomiting of pregnancy. After lactic acid in vomiting of pregnancy. Now open chapter tabacum. In tabacum, just see vomiting of pregnancy. When lactic acid fails, and within bracket you will get Psorinum too. So after lactic acid fail in vomiting of pregnancy, or in case of hyperemesis gravidarum, there are 2 medicines. One is tabacum, next one is Psorinum. After arnica and traumatic affections of ovaries. Okay, so just you can understand the intensity of this symptom. Psorinum is also very important in bad effect of injury. Okay, sulfur follows Psorinum well in mammary cancer. Next. So these relationships are very important from Psorinum. So this is all about Psorinum from Allen's keynote. Okay. Now I'll start Psorinum from Boericke. जितना बार बुक में रेफर करोगे उतना ज्यादा चांस होगा सिलेक्ट होने का भी. Start. Often gives immunity from cold catching. Okay. So don't be confused with other medicines like tuberculinum, like bacillinum, like calcareacar, silicea. This is lining of Psorinum. Syphilitic, inherited or tertiary. Okay. Chronic headache, hungry during attacks with vertigo. So line is very similar to Allen's keynote, but here addition of vertigo. Okay. So headache during hungry with vertigo. Chronic ophthalmia that constantly recur. As in Allen's keynote, we have discussed hay fever occurs annually in the same day of month. Okay. So here chronic ophthalmia. Offensive discharge from eczema around ears. Most fetid pus from ears, brownish, offensive. So we all know about offensiveness of Psorinum. Next. Feeling of, this is a unique symptom, the feeling of ulceration under sternum. This is due to retroesternal burning. Okay. As we read one line, the eructation of like rotten egg. Okay. That is hydrogen sulfide like smell. That eructation like rotten egg, medicines were antimtat, arnica, graphitis, and also I added magmure. Okay. So here this reflection in this form, the feeling of ulceration under sternum. होता है ना, लगता है जलन हो जा रही है, बहुत इरेक्टेशन ऐसा हो रहा है. So that's why this symptom. Hard difficult stool with blood from rectum and burning piles. Okay. We have also discussed in Allen's keynote, constipation of infants in pale, sickly, scrofulous children, and very important here, that leukorrhea. That leukorrhea, fetid, lumpy, with much backache and debility. Leukorrhea with much backache. Got it? In Allen's, their line was that constipation with backache, as I compared with Aeschylus hip. Okay. So here leukorrhea with backache can compare with medicine Upion. Open Upion. EU. Start from EU. I think this line in Upion in italic. EUPION. Eopionum. Leukorrhea with debility and severe backache. Got it? Next. Eruptions around fingernails. Okay. Like in natramure, you will get hangnails. So here eruptions around fingernails. Urticaria after every exertion. And similar line also in medicine like natramure. In bracket, you will get apis male. That urticaria after violent exercise or urticaria after exertion, you will get in Allen's keynote medicine is natramure. And within bracket, you will get 3-4 medicines like apis male, like apis, urtica urens, calcareacar, Okay, that's okay. So urticaria after every exertion, worse coffee, and now very important and frequently asking question. Psorinum patients does not improve while using coffee. Okay, while using coffee, patient will not improve. For MCQ point of view, always keep in mind constipation of habitual coffee drinker. That is Ignatia from Allen's keynote. Irresistible craving for coffee. Medicine is Angostura from Boericke. Open Angostura. AUNGUS. Irresistible desire for coffee. Irresistible craving for coffee. I think AN or AUN. जैसे एक बार देख लीजिए. AN. Irresistible craving for coffee. Got it? Okay, so in Ignatia, you will get constipation of habitual coffee drinker. You will also aggravation from coffee in chamomilla, also get in Nux vomica. Okay, in Nux vomica and in Boericke, you will get dyspepsia from coffee. It is very important for MCQ. Dyspepsia from coffee, Nux vomica from Boericke. Okay, dyspepsia from coffee. Got it? So Nux vomica, chamomilla, Ignatia. Nux and Ignatia belong to same family. Chamomilla, coffea, Ignatia. Sorry, chamomilla, Ignatia, Nux vomica. Here, Psorinum and craving for coffee, Angostura. Keep in mind. Okay. 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 So this is all about Psorinum from two books, Allen's keynote as well as from Boericke. जितना ज़्यादा कंपेयर कर पाओगे, जितना ज़्यादा उसको बार बार सर्च करोगे, जितना ज़्यादा सोचोगे और जितना ज़्यादा खाली टाइम में सोचोगे, उसको भी यूटिलाइज करना है ना. मेट्रो का टाइम है, बस का टाइम है, कहीं जा रहे हैं, वो टाइम सब यूटिलाइज करना है. उस टाइम सोच सकते हो ना, उस टाइम कुछ कर तो नहीं पाओगे रिक्शा में बैठ के, तो सोच तो सकते हो ना. तो रादर देन थिंकिंग कुछ और मूवी और के बारे में आप यही सब सोचिए.